everyone. Today in this episode, I'm going to talk about obsessive compulsive disorder, which is also abbreviated as OCD. You have had a long day and you decide to retire for the night when suddenly you realize that you may have left the front door unlocked. You become anxious and go check if it is locked. Once you have ensured that it's locked, you relax and return to bed. This regular anxiety is good for you as it ensures that you are alert about your environment. Sometimes, however, these thoughts can be recurring and intrusive. You may go check the door and ensure that it's locked, but when you return to bed, you start to worry about it again. You go check the door again and return to bed, but your worry still remains. These recurring thoughts, which make you feel anxious all the time and affect your daily life in the process, are known as obsessions. Obsessions can vary. Some people are obsessed with cleanliness and may worry that their hands are germ infested even if they washed them less than a minute ago. People with OCD experience severe anxiety and distress. To relieve this anxiety, they perform some repetitive acts known as compulsions. Compulsions offer temporary relief to people suffering from OCD. In severe cases, the urge to perform such actions repeatedly can severely hamper a person's daily life activities. When this cyclic occurrence of obsessions followed by the compulsive behavior begins to hamper a person's ability to cope with daily life, it may be a case of OCD, presence of obsession, compulsions, or both. Now, what are the symptoms of OCD? OCD can be detected by observing the compulsive behavior of a person. The most common types of symptoms are first being cleanliness. People who have a constant fear of contamination, they repeatedly wash their hands, their bodies, or either clean the house. Second one, order. Some people are obsessed with symmetry and order. To relieve their anxiety, they can be seen rearranging books, kitchen utensils, or aligning carpets, pillows, and cushions repeatedly. Third one being hoarding. People who find it impossible to dispose of anything. They collect old newspaper, clothes, mails, and other objects for no apparent reason. Fourth one being counting. Some people repeatedly count their belongingness and other objects used in daily life, such as the number of steps on a staircase or number of lights in a hallway. If they lose count, they go back and start again. And the last one being safety. Some people have irrational fears about safety. They are constantly checking whether the doors and windows are secure, whether the gas has been turned off, and so on. The obsessions or compulsions are time-consuming. For example, they may take more than 1 hour per day or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So what are the causes of OCD? Although it is not clear as to what causes OCD, some known factors are biological and genetic factors. OCD can sometimes be inherited from the parent. Some research links the development of OCD to a chemical imbalance of serotonin in the brain. So second one is life changes. Sometimes major life changes such as new job or the birth of child thrust more responsibility on a person. This can trigger OCD. So behavioral factors. Some people who are extremely organized, neat, meticulous, and those who like to be in charge from a young age sometimes run the risk of developing OCD. Last one being personal experience. A person who has experienced severe trauma is likely to be affected with OCD. For instance, contracting a severe rash by touching rat poison in the house can lead to hand washing compulsions, which may be immediately after the incident or sometime later in their life. So now, coming to treatment for OCD. Treatment for OCD has been found to be very effective, and most people who receive treatment recover completely. Depending on the severity of OCD, treatment ranges from a variety of medications to therapies. In mild cases, therapies alone are sufficient. In more severe cases, medication is prescribed. So now, what do you have to do when you care for someone with OCD? Being around someone with OCD can sometimes be frustrating and disappointing. It is important to remember that the person is not trying to be a burden, but are merely trying to cope with their anxiety as best as they can. It would be advisable to talk to them about getting help. This can be challenging and will require patience, as most people do not believe they need help, and in some cases, people with OCD feel a sense of shame regarding their obsessions. You can play an active role in helping a person recover from the problem. This may include encouraging them to face their fears from time to time. However, the first step must be to seek professional help. So now, how do you look after yourself if you are suffering from obsessive compulsion disorder? So talking to someone you trust can go a long way in helping you cope with OCD. It can help reduce the fear associated with the obsessions considerably. Physical activity, for instance, playing a sport, can boost your mental well-being and helps you avoid intrusive thoughts. The most important thing you can do to help yourself is to reach out to a mental health professional. Aside from your regular treatment, they will be of great help in drawing up an action plan for you to cope with OCD. With this, I end this segment and thank you so much for listening.